I mean, political activities, I did a little bit of that when I was in college. I was associated with the newspaper, and during the McCarthy period, wrote some strong editorials about that. And then what happened during the 60s here was after the assassination of Martin Luther King and the riots here in Washington, we very quickly established a local chapter of the Medical Committee for Human Rights. Medical Committee for Human Rights was started by some Boston physicians who wanted to be sure that the children, some of their children who were participating in the civil rights marches in the South, had adequate medical coverage for anything from being beaten or having blisters or having a psychological break, psychiatric break, and so on. But they also, during the riots here, we provided medical coverage, and so that wasn't really, it was nonpartisan, it wasn't really political. Then that sort of became transformed into providing medical coverage for some of the demonstrations during the Vietnam War. So we were involved in that, and we had, in fact, the headquarters for the local chapter was in our basement down here for a while. And there was a short time where there was some question about what would we be allowed to do at the NIH. We invited Dr. Spock to speak, and there was some question about whether that was appropriate, and had some posters up and so on and so forth. But it wasn't a major thing. And then the Medical Committee for Human Rights became more and more focused on the idea of medical care being a human right, and that is something that the society as a whole, the government, should provide to the population at large. And at that time, this was just around the time that we were leaving for the sabbatical in the early 70s, it became clear that that became a major political issue and was going to be solved or not solved by the political process. It's still not being solved, but it's in the appropriate place where the decisions should be made by the Congress and by the President and by the Supreme Court and so on. And so I didn't feel that the Medical Committee for the Human Rights is going to really influence that in a dramatic way, and so I left that organization, didn't continue to participate.